Hello again, and welcome to Spotlight. Today we're going to be doing a very, very different show. Obviously, because of the virus, we are not all in the same place, and we're going to be talking about the virus, and we're going to, in particular, about what Ludlow Emergency Preparedness is doing about the virus. My guest will be Ron Bixby, who is the director of the emergency management, and Scott Murphy, who is the municipal manager of Ludlow. Welcome, gentlemen.
Thank you.
Okay, why don't you begin by telling us what the status is of the municipal status is regarding the virus.
Let me address that, Ralph, if you would.
Okay, Scott.
All right. So currently, the town is maintaining townwide services, including public health and public safety. We're working with minimal staffing to meet the governor's declaration to stay home and stay safe. All departments are operational. Some have relocated, some are working remotely, but all can be accessed by the public. We're working in coordination with our continuity of operations plan and in coordination with Ron and the local emergency management plan. That's kind of where we're at right at the moment.
Okay. Now, as I understand it, the town hall is closed now.
That's correct, but we have signage and website information on how to access each department. Planning and zoning is operational. You can actually get into the building if you needed to get into the town clerk's office because she's in there daily. You would just call her office. She would clear you, come in and open the door and let you in, and you could do some research that way. Of course, only 1 or 2 people in at a time, and that's up to her as she coordinates that. The rest of the departments are available on the website or by phone or emails and text.
Okay. Now, what's happening just with regards to the state emergency and the governor's recent orders? Ron?
Well, basically the emergency operations center, the EOC, has been open and it's been fully in operation. Governor, as you know, has issued several direct issues, such as closing the school to the end of the year, or no school for the rest of this year, limited travel in and out of the state of Vermont. Anybody that is recently entering the state of Vermont is requested to a 14-day quarantine, self-quarantine, and that means very strictly, once you cross the border, you go straight to your residence, be a second home or full-time residence, and quarantine. Don't go anywhere until the 14 days are up, and then self-check yourself for fever and make sure you're feeling well before you do enter out of the residence. The state of Vermont is very active in this, obviously taking it very seriously. Yesterday's report basically was that we now have 321 positive cases in the state of Vermont, with 16 deaths attributed to the COVID-19. So it's a very serious situation, and everybody's handling it very well to this point that I can see. So.
Okay. Now, the dating on this thus far has been sort of to the end of this month in April. Do you anticipate that it's really going to go beyond that?
I feel it is. I think it's a preliminary date set up with the best results, expecting the best results. I think it'll be well reviewed at the end of the month. I certainly would expect it to be extended till June 1st. at least the way it looks right now.
So what's going on with the federal services and the aid that the federal government's going to be providing in this?
All right, Ralph. So I've got some websites that would be really helpful for people, and I'll show that again in a few minutes towards the end. But the first one is ludlow.bt.us. So at that website, we have links to a lot of local and federal organizations that will be helpful for the
Okay.
public. One of them is building Black River Good Neighbors Services. We have Senior Solutions, Council on Aging. We have state updates, daily state updates on COVID-19. We have some CDC federal updates. Vermont Department of Labor, that is kind of an important one for unemployment information. I'll talk about that a little later. Restaurant status, that's a good one for locals. It has pickup and delivery services, so you can click on that link on our website and find out who's open. And then there's Chamber of Commerce resources. Then we have 3 other helpful links. This is the main one I want to drive home to people. It's important. It's healthvermont.gov. That's run by the State Department of Health. That has all the information you need and directs people to the issues that are going on. So again, healthvermont.gov on that. It has emergency programs, has childcare options, daily updates, health updates. And then the other one that's local that would be really helpful for people is the Your Place in Vermont. That's the Chamber's website. They've coordinated regionally with a lot of businesses and stuff, and I think people can access some good information on that. For instance, they have, again, they do something about the delivery for restaurants, but they also have a free food link. They have information on the CARES Federal Act, which is just kicked in last week, and that's the Coronavirus Aid, Relief, and Economic Security Act. There's a link to the Vermont Agency of Commerce and Community Development, ACCD, and then the Vermont Department of Labor for unemployment and employer questions. And then it also has the U.S. Small Business Association and the Vermont SBA, as well as VITA and U.S. Vermont Development Center. So, and that has disaster recovery information. So that link, yourplaceinvermont.com, is put on by the Chamber, has similar links as to what the town does, but also has additional things for businesses. And then a couple others that you would be interested in is we have Vermont Emergency Operations Center, and that's the one Ron was referring to earlier. So that's it. Those are the 4, and again, I'll mention those. I'll show that those links in a few minutes again.
Okay. Now, we've really been discussing some of the resources that are available to the public on this, and I think you've gone through all the key websites. And what about businesses, local businesses? How are you dealing with them? I know a number of them have either closed or are only doing business via online activity.
Right. Our main focus has been providing information to the public, and we are not directly involved with assisting the businesses. We provide information for them and let them access the state websites. And the state is actually just getting a handle on this CARES Act that was passed recently. And so they're still formulating how they want to handle it. We get information daily, and so by the time this gets aired, a lot of things will have changed. But that's why it's important that people go to the website, ludlowvt.us, so that they can get current information on a daily basis. And I just want to remind everybody, Ralph, before we move on, that it's really important for people to, as the governor mentioned in his executive order, to maintain a distance of 6 feet between people at all times. Practice appropriate hygiene, including regular and thorough hand washing. and report if you're feeling sick to your health provider. And finally, clean and disinfect regularly touched surfaces. We've found that people in general are adhering to these regulations. We're really lucky, I think, in Ludlow that people are listening, paying attention. We have to be careful to continue to monitor that because the longer this goes, I think people are going to get a little impatient.
Okay. Ron, what are your feelings about this?
Well, one thing I'd like to make understood and clearly emphasize is that things are changing on a daily basis. I mean, we can, one of the main reasons we're giving you all these websites, and another one that I utilize every day is for emergency management, is vem.vermont.gov, and that's where I get 90% of my information for the emergency management role that I play. But I think the key here is that things are changing rapidly, and they're changing daily, sometimes 2 or 3 times during the day. And I think it's really important to follow some of these websites. I know there's a lot of information out there, and you can spend a lot of time reading it, trying to understand it. But I think those people that are out there that really are concerned and want to listen and abide by the recommendations is to get on those websites and follow them. I know I do every day. I get an update. I get a COVID-19 response every day, some like 20 some odd pages that I read through. And it gives me a breakdown of exactly what every department within the state of Vermont is doing on a day-to-day basis. I think that's really important. I think it's inevitable that this will pass, but we need to be very patient, and we need to adhere by the rules that Scott just mentioned. I know all the departments within the town of Ludlow have cut their staff down to the point where they can still operate, and they're doing a great job protecting each other. And I think that's what most people need to do. Honor those stores that are shut down. Curbside service is available in 90% of the stores right now. Don't be afraid to utilize that and help people keep their distances. I think that's really important.
Okay, well,
Ralph, if I could piggyback on that a little bit for a moment. So Ron mentioned he gets this report daily, as do I, and it's from the Vermont State Emergency Operations Center. And here's one update, just as an example of how quickly these things are changing. So just today, the key update came through. One of the key updates came through that the CDC now is warning that the transmission of this virus can go as many as 25% of people infected with the virus might not show symptoms at all. And now that's new information. So we anticipate getting more of this new information on a daily basis, and I'd like to make sure that the public gets this information also, and that's why we're tying them into the websites that are available.
you know, one of the things that I've been following is apparently they're keeping track of cars coming into the state and leaving the state by plate numbers to indicate the states that they're coming from. Is that has that been a problem here in Ludlow? With outsiders coming in?
Well, it's not a problem. There, as far as I can tell, and from what the police in Ludlow here has informed me, is that they're adhering to the regulations of staying in and self-isolation. But as far as what you mentioned with the state police monitoring people coming into the state, excuse me, is that they're doing that for purposes of projecting healthcare. So what they're doing is anticipating a large increase in numbers of beds needed in the hospital and that type of thing, services needed at the hospital, and that's why they say they're doing that.
Okay. So,
The other one thing, Ralph, I'd like to say also, and not all out-of-staters are participating in this, but I think one of our main concerns at the grocery stores is hoarding. Um, Only buy what you need to carry you through for a week. Let's not load up and take things away from everybody else that needs it desperately. I think we really need to monitor um, purchases in the grocery stores so that there's enough for everybody and not just the few that have the extra money that want to hoard everything. So I think it's, and I'm not blaming the out-of-staters for that. I'm blaming anybody that goes into the stores to hoard. I think that's something that really needs to be looked at.
just from my own personal experience, I've noticed that there's an awful lot of paper goods that are being purchased, and I do have to wonder if they're all needed immediately, but
Ralph, if I can jump in one more time. Again, that Vermont State Emergency Operations Center. So on those daily updates, each department in the state, public information, FEMA, health and medical branches, human services, logistics, and economic development, they each have a breakdown of what's happening statewide. And for instance, the economic development branch, that shows you the supply chain. It gives you a supply chain update on a daily basis. For instance, I'll just quickly read this. It says bread, improving, supply recovering faster than expected. Milk, ample. Eggs, improving, big increase in cost. Paper products, paper towels improving, bath tissue constrained. We kind of knew that. It's, wipies, hand sanitizers, rubbing alcohol, no improvements. Delivery pushed out for weeks. Meat improving. Ground beef is in tight supply. Chicken supply rebounding. So it breaks down and gives people a lot of good, pertinent information that they can use.
okay, well, in general, you seem to feel that Ludlow's handling this pretty well. Is that a fair summation?
From the town standpoint, I would have to agree with that. I think everybody's doing their fair share and adhering to the governor's directives and working together. We're all in this together.
I'd like to echo that too. I think that the relationship between all the departments and all the town officials and myself have been tremendous. Everybody is working together, and we're constantly contacting each other for more information and updates. So I think I think the town of Ludlow's in pretty good shape considering.
Well, I'd just like to thank both of you and all the other people in the various departments in the town for what they're doing. I know there's a lot that's being done that we're probably not aware of, but I do think you fellows are doing a marvelous job. Now, Scott, could you hold up that those websites?
Is that readable?
Yes, that's, well, I can read it. So if I can read it, I think anybody can read it. Okay.
Ralph, I think I'd like to just to let everybody know that both Scott and I are available 24/7. And I'd like to give you my cell phone and home phone numbers and let everybody know that if they have any questions and they need to have some answers, don't hesitate to either call myself or Scott. And we will be, if we don't have the answer, we'll certainly get it for you. So just for the information here, my cell phone number would be 802-345-9910. My home phone is 802-228-4530. And I'm currently working in my office on a daily basis with our door locked as per law. And my office number is 802-228-8823. And Scott, I know, has some phone numbers that he can give you also for his contact.
Okay.
So the office number, the local number here that you really want to connect with everybody in each department would be 802-228-2841. My home phone number is 802-447-3600. 7740, but the cell phone is the easiest way to reach me at 802-245-4990.
Okay, well, I want to thank both of you for taking this opportunity just to talk to us about the what's going on in Ludlow about the virus. It's a very hectic problem, and I know a lot of people are going to be happy when it's over, but we really appreciate the work you fellows are doing.
All right,
So-
well, thanks, Ralph. Thanks, Ron. Appreciate it. May God bless you and your families. Let's have faith and not fear. And we look forward to seeing you again soon.
Okay, and I hope everyone can survive this, and I'm pretty sure we're going to. And again, thanks a lot, and that's going to be a wrap for now.
Great. Thank you, Ralph.